Yeah, there are huge hurdles out here. A couple silly things, but the reality of the world, is that the insurance industry wants no competition. Right, so they've created the rules, they set the rules, right? They have quite a few of the people in Washington, D.C. potentially in their back pockets. Everybody likes talking about healthcare and how broken it is, but it's a great wedge topic for people to fight over and create votes over.
Yep.
But nobody's really fixing some of the underlying legislation that allows innovators to come forward and to go, hey, I really want to provide great healthcare to you.
Yep.
One, I think, just as an example, and I was at a meeting this past week with a medical cost sharing group, and medical cost sharing is going, okay, Phil, I'm going to bring your company together. I'm going to bring my company together, right, to have us kind of join together and share in each other's medical expenses. Right, kind of create a co-op, right?
Yeah.
And let's get more businesses like us to come together and let us just put money into this pot to help each other pay for each other's healthcare, and do it without an insurance company, and do it without all the middlemen, and let's all buy healthcare services direct, and let's make sure we get great primary care. Let's do all of those things together. But there are so many regulations and so many rules and so many headaches around it that make it difficult to do that well. And so there's a very narrow pathway that medical cost sharing has to walk through that actually handcuffs its ability to be unbelievably impactful. When we talk about, I'll give an example, when we talk about being able to go in and help the uninsured, I tell people, I don't want you to get insured. Right. I want you to get great access to great health care. I want you to join a community where we can help make sure that, God forbid, something bad happens, there's capital to help be available to pay for it. Right. That's really what we want to be doing. I'll give an example. We had a 15-person company, that's a small company, right, that decided to sign up with us. They were on a traditional insurance-based plan. Only 4 people could afford it, right, the owner and a couple of the managers. The 11 other guys couldn't afford it. We could go into there, and this is actually what we did with this company. We can go in there with a medical cost-sharing platform paired with HipNation, and the company was able to provide health care for all of the employees for less than what they were paying for 4. Unbelievable, right? Access to care. And by the way, every single one of those employees now has their doctor's cell phone, unlimited access to their primary care doctor, no charge to see their primary care doctor, right? Health care. And God forbid, if one of the guys gets sick, they're going to be responsible for $1,000, and the community will kick in and share on the cost after that $1,000, as opposed to their insurance plan that had a crazy max out of pocket that the guys would be bankrupt if it happened to them.
Yeah.
Right. That's bringing healthcare to people. But the regulations are so difficult and so tight that there's such a narrow pathway to walk forward that you go, are those people up in D.C. trying to help us get health care to people, right? Or are we just working and cowtailing to the regulations of an insurance-based healthcare system? And right now that answer is the latter. It's the healthcare system. And so there's a lot of things that I would love to completely go up and rewire in D.C. and go, are your hearts towards healthcare? Yep. If so, then step back and step outside of our way and let us come forward and bring great health care to people in an affordable way.